I love fat grafting. I do fat grafting in the vast majority of my reconstructive cases, whether it's a flap, direct to implant, or a 2-stage implant-based breast reconstruction. Sometimes I actually do fat grafting alone to create a small breast mound. But let's talk about some instances when fat grafting would not be a good option for what you're trying to achieve. So the first thing to think about is what is going to keep that fat alive when it's put into the chest area. The analogy that I use with my patients is think about a garden. If you're going to plant seeds, you need a lot of soil. If you try to plant seeds and there's no soil, it's just going to die. This is exactly the same for fat grafting. If you don't have breast tissue or a robust mastectomy flap to inject the fat into, it's not going to survive. It's going to die. It's not going to be able to reestablish a blood flow if you're just injecting it into a cavity. So what is fat grafting not good for then? Fat grafting is not good for taking out an implant and filling that space. I have some patients ask me to do that. Fat grafting can be really challenging to fix divots or concavities because once again, a divot or a concavity it's a hole. It's an absence of material. So if there's nothing there, there's really nothing for me to fat graft into. Now, sometimes we can try and maybe a little bit of the fat will work, but it's certainly not going to have the same yield or be as successful if I was able to inject that fat into healthy tissue. That makes sense? Other instances in when fat grafting might not be a good option is if you are really afraid of fat necrosis. Studies show that about 60 to 80% of the fat survives in non-radiated breasts, which means that about 20 to 40% of the fat doesn't survive. Your body absorbs most of that if your plastic surgeon puts the fat in thin aliquots as opposed to big old chunks of fat. But for some patients, there can still be lumps, bumps, and they can feel that fat necrosis. That can be very triggering for a woman who had a breast cancer where she felt it. And so some of my patients, when I discuss this with them, they say, it's just not worth the risk. But fat grafting can be really lovely for increasing upper pole fullness, adding, adjusting simple size differences between the breasts, or even doing a primary breast augmentation for symmetry purposes. If you've had fat grafting, let me know your experience below. And if there were things about fat grafting that you were nervous about that made you not want to get fat grafting, let me know those too.